I'm Dr. Errol Billinkoff. Choosing to have a vasectomy is a major decision in most men's lives and often requires considerable thought. I'm hoping that my website, winnipegvasectomy.com, will help you get the information you need before taking that final step. This video is intended to give you an overview of the vasectomy process. But before I get into the details, there are two basic questions you need to answer. Is a vasectomy the right choice for you? And where should you go to have a vasectomy? The answer to the first question may become more clear after some serious discussions with your partner and giving a lot of thought to your decision. Reviewing the information on this website and watching my video should also be very helpful. Now I'm going to explain to you why the Billinkoff Vasectomy Center is the place you should go to have your vasectomy. First and foremost is experience. I was the second doctor in Canada to be trained to perform the no-scalpel vasectomy back in 1992. Since then, I have performed over 25,000 vasectomies. At the present time, I am averaging about 50 cases per week. Only one other doctor in Canada has done over 25,000, the doctor who trained me in Ottawa in 1992. Think about that number, 25,000. Let me put that number in perspective. Other doctors who might consider themselves to be experienced have probably done a few hundred or possibly even a few thousand vasectomies, but no one in Western Canada comes close to 25,000. And why is that important? Think about sports, playing a musical instrument, or any other technical skill. The way to achieve competence and accuracy in anything is through repetition and practice. The second reason is technique. The no-needle, no-scalpel vasectomy, which is the technique that I use, is, as of 2015, considered to be by many experts the state-of-the-art technique for performing a vasectomy. No other form of permanent contraception has as high a success rate and as low a complication rate. This is often the reason why so many women encourage their partners to have a vasectomy. With this technique, a spray is used to freeze the area instead of using a needle. The procedure is done through a tiny hole which is made in the center of the sac. No needle, no scalpel, no incision, and no stitches. And the operation usually takes less than 10 minutes. I could tell you how quick and easy it is, but I will leave that to your friends, relatives, and co-workers, or perhaps they already have. No matter where you live in Manitoba, Western Ontario, and various parts of Saskatchewan, you probably won't have to look very far to find someone you know who has been here. Close to a third of my patients come from outside of Winnipeg. The third reason to have your vasectomy here is that I strive to provide a high degree of patient satisfaction. Over all these years, I have refined every step of the process in an effort to streamline your experience from start to finish. By now, I'm sure you've realized that vasectomies are what I do, so why would you go anywhere else? I have developed this website for you and your partner, which you can access 24/7, which gives you all of the information you require. Take a few minutes to review this website. You will find answers to frequently asked questions, as well as explanations about the procedure and the recommended samples you should provide after the surgery to confirm that your operation was successful. All patients must get approved for surgery before they can schedule their vasectomy. This is usually done at an office consultation to determine if you are a good candidate for surgery. This is an office appointment which you book from this website. A referral from another doctor is not required. You can create an account, then choose any available appointment time. Once you have been approved, you can then book your own appointment for surgery from this website. Our custom software was designed to show you all available appointment times and lets you choose whichever one is most convenient. There is no fee for either the office consultation or the surgery. Provincial Health covers all of the basics. What could be easier? Well, there is something easier. For those of you who prefer not to come in for an office consultation, we offer an online consultation instead. This was originally designed for out-of-town patients, but is now available to anyone. Patients have the option of filling in a questionnaire and submitting it to me by email. Once I've reviewed the questionnaire, I notify patients if they are approved for surgery. Patients can then go ahead with booking their vasectomy on this website. there is a nominal fee for this online consultation. This is not recommended for patients who are very young or for those who are not in a stable relationship. Also, keep in mind that the office consultation offers several advantages. I have the opportunity to examine you to make sure that everything is normal and that I can get the job done. Various factors such as previous surgery, like hernia operation or being very overweight, don't usually cause a problem, but occasionally they do. This is also an opportunity to have any of your questions answered. Being on aspirin or blood thinners is a concern, and when having surgery, this needs to be discussed. Also, I like to know who the fainters are. You know, the ones who pass out when they have blood taken. This too should be discussed ahead of time. Often these patients should have their surgery done in a hospital where they can be given medication to relax them. This works better for both of us. So just to be clear, I must approve you for surgery before you can book an appointment for your vasectomy. This can be done either by coming to my office for a consultation or by using the online consultation where you submit a questionnaire by email. You get to choose either method. All appointments are booked online. Once you have been approved for surgery, you may book your surgery also online. You will receive an email confirmation which will give you a few instructions on how to prepare for your vasectomy. The surgery is performed in the relaxed and casual atmosphere of my office, conveniently located on Lombard Avenue off of Waterfront Drive in downtown Winnipeg, just a short walk from Portage in Maine. So to summarize, this website is your friend. From here you can do just about everything except have your vasectomy. If after reviewing this website and watching my video you have a question or are unclear about anything, please contact my office for clarification. A vasectomy is a permanent form of male birth control. It doesn't change your sexual function or your hormones. It can be reversed, but the chances of success are reduced by about 10% per year after the vasectomy. In other words, if it is reversed within 1 year, the chances of success would be reasonably good. But if you wait 5 to 10 years, chances of success would be less than 50%. A vasectomy reversal is not insured by provincial health and could cost over $4,000 to have your vasectomy reversed. To understand how a vasectomy works, let's review the anatomy of the male reproductive system. Sperm cells are produced in the testes and then are stored for about 2 months in the epididymis gland where they mature. During intercourse, muscle contractions move the sperm from the epididymis gland through a tube-like structure called the vas deferens. As the sperm travel through the vas deferens, they mix with semen produced in the seminal vesicle and the prostate gland. When orgasm occurs, sperm and semen are moved together through the urethra and are eventually ejaculated through the end of the penis. With a vasectomy, a section of vas is usually removed and the ends are blocked in various ways to prevent sperm cells from getting through. Unlike this video, I only apply a single clip to block off each vas. The no-scalpel procedure allows the surgeon to get to the tubes without incisions. An anesthetic spray is used to freeze the skin in both vas deferens. Next, the tubes are located just under the skin of the scrotum. A specially designed instrument is used to grasp the tube in the middle of the scrotum, while a sharp-tipped instrument is used to pierce the skin, then gently stretch a small opening through which the first tube can be exposed. The vas is lifted out and blocked through this opening. Then the second tube is lifted out, then blocked through the same small opening. No stitches are needed to close the tiny wound, which usually heals in 5 to 7 days. Imagine that these sections of cable represent the vas with the lower end attached to the testicle. There is an outer sheath and an inner tube or a tube within a tube. I first make a slit in the outer sheath, exposing the tissue overlying the vas. This tissue contains tiny veins and is stripped away, exposing a small section of vas seen here in white. I cut out a half-piece inch of vas. I cauterize the vas ends, then drop them back inside the sheath. To make sure that the two ends never grow back together, I keep them separated by pinching the sheath between the two ends of the vas and keeping them separate by crimping the sheath with a titanium clip. This creates a permanent barrier between the two ends and reduces the chances of them growing back together. And no, they won't set off the metal detector at the airport. This is an example of the small clip that I use to pinch the sheath between the two ends of the vas, which stays in permanently without any problems. By far the most common concern expressed by patients about having a vasectomy was a fear of getting this needle. In fact, some patients were downright terrified about it. Along came the more comfortable technique for freezing the skin and the tubes. A device that contains the same liquid anesthetic as was used before in the needle is instead placed in a spray applicator. This device simply squirts the liquid into the skin. By holding the tube right up underneath the skin, enough liquid gets through the skin to freeze the tube as well. This simple method eliminates the fear and pain of the needle and works equally well. The freezing works within a minute. Only an area the size of a dime is frozen, which is where the tiny opening is made. Once the freezing has taken effect, the operation is virtually painless. The freezing lasts for about 2 hours. Patients do not notice any difference when the freezing has worn off. Those who are driving several hours to return home should not expect to have any problems. Patients can drive themselves home from their surgery. Many patients ask if they have to take it easy for a whole week. Aren't 4 or 5 days good enough? Well, for some patients they are, but for others it's just too soon. It's impossible to know who will need longer to heal. If your work or recreational activities involve standing, lifting, or straining, you should arrange to avoid those activities for a full 7 days. If you return to those activities before a week, you are increasing the risk of becoming swollen and sore. Any sexual activity should also be avoided for 1 week. Climbing a modest number of stairs is not a problem. I am frequently asked about working out or other exercise. Although virtually all patients are advised to resume their normal work activities after 1 week, I still think it's a good idea to avoid sports, working out, and other unnecessary activities like snow shoveling for a period of 2 weeks after, just to be safe. It is not unusual to feel a little sore in the days following a vasectomy, but you should not be in pain. The key to an easy recovery is to prevent swelling by avoiding prolonged standing, which is more than 20 minutes at a time, applying lots of ice or frozen peas, and using an anti-inflammatory pill such as Advil if needed. I strongly recommend not having a vasectomy before a planned trip or vacation. Although complications are rare, you definitely don't want to have a problem while you're in Mexico with the family or during a ski vacation. If you have any travel plans in the future, I suggest having the vasectomy after you travel and not before. And lastly, if your wife is expecting, and especially if it is a planned pregnancy, I always recommend waiting until after the birth of the baby before going ahead with the vasectomy. The reason, of course, is that no matter how smoothly previous deliveries may have gone for you, you never know what might happen. Given the worst case scenario where the baby might not survive, a couple might want to try again. Obviously, having a vasectomy first would make this difficult or impossible. It is quite normal for there to be sperm still present for several weeks or months following the vasectomy. So it is very important that you use another form of birth control until a sperm sample shows that there is no live sperm remaining in the ejaculate. If you live outside of Winnipeg, your sample can usually be taken to a local lab or hospital instead of having to bring it to Winnipeg. I recommend that you drop off your first sample after 3 months and then a second sample 1 month after the first one, just to be absolutely certain that there is no more sperm left. If both samples show that there is no live sperm, you may discontinue all other forms of contraception. Your operation has been a success. By now, I think you can understand why more men in Canada have had a vasectomy than women have had tubal ligations, and why more men have had their vasectomies at the Billinkoff Vasectomy Centre than anywhere else in Western Canada. And don't forget, in the time it took to watch this video, you could have had a no needle, no scalpel vasectomy.